morning. My sincere thanks to Professor Lata Bichle for this and her team for this invitation. And greetings from Indian Rheumatology Association. And you have to excuse me that I'm from South India and my Hindi is pretty bad. So I will speak in English. And if there's any other clarification, please raise your hand and my colleagues will help you to understand what I'm trying to tell. And as a rheumatologist, we know that without patients, we don't exist. As doctors, we don't exist. So our entire aim is to help patients. And in that way, we also get help. We do our living by seeing patients. And we are seeing most of the doctors don't see it as a simple profession where to earn money. And we always want to give back to the patient community. And Indian Rheumatology Association has one of the stated activities public education and patient education. And we have a lot of resources and we have spent a lot of time doing this particular activity. And the entire month of April since last year has been observed as Rheumatological Disease Awareness Month. And why this is important is I'm sure many of you would have experienced in your life as patients. When you were diagnosed to have rheumatoid arthritis or ankylosing spondylitis or lupus or dermatomyositis, scleroderma, none of your family members or friends or relatives would have heard about it. So nobody knew what it is. And it is extremely difficult for you to get a diagnosis right because many doctors, general practitioners themselves have not been aware of this disease to a certain extent, to the extent that they were aware of diseases like diabetes or hypertension. So this leads to a lot of issues for the patients. And we also understand that from the patient perspective, modern medicine, rheumatologists, physicians, we are one of your options for a treatment. You have multiple options to choose. You have a pull of Ayurveda, homeopathy, and whatever. There are so many pathis around. And patients might see modern medicine doctors as one of the options. And unfortunately, rheumatic diseases being uncommon in the sense up to 1% of the population may have one form of arthritis, that is autoimmune arthritis. But if you include osteoarthritis, which can occur, almost 50% of women over the age of 50 years may have osteoarthritis. So osteoarthritis is very common, but the focus here for us is autoimmune rheumatic diseases, which if diagnosed early, can make a huge difference to your life. If the disease is diagnosed within 3 months, 6 months, treated adequately, you can lead a normal life like any one of us. But if the time is lapsed, if it goes beyond a year, then we can always treat, we can make people better, but patients cannot become totally normal because some amount of damage would have happened to their joints and fingers and feet. So that would make their day-to-day activity more difficult. So that is sometimes we feel bad about it because the patients don't come in the right time and they have missed the boat and we also miss the opportunity of making them totally normal. So we need to create an awareness that these diseases are though rare, they do occur much more commonly than some of the cancers which you are familiar with. Most of you know about blood cancer thanks to a lot of movies and most of the climaxes our hero will have a blood cancer. So people know about blood cancer, but some of our diseases are much, much, much more common than blood cancer. And when you get a joint pains, people think that it is due to old age. And if if you are a woman, people say you have calcium deficiency. And if you are pregnant, it's because of hormones. So there is a chance that there is a huge delay in the diagnosis. So we need, as a specialist in this area, we want to educate the doctors, general practitioners, and also create an awareness amongst the public. Now with the current internet era, people who are educated, who have access to internet, at least they seem to learn about these diseases quickly. Sometimes they get scared of the information available in the internet, because internet gives a lot of information. Some are good, some are very bad, or some are frankly wrong. And it is difficult for a person who is not trained in this field to filter this information and take the best out of it. So it is good for you to go to the internet, get the information. It is better to bring them to your doctor and discuss this with your doctors. And we would be happy to discuss this, whether something is good or something is bad or something is wrong. And the care of rheumatological diseases doesn't stop with medications alone. And as a doctors, we are good in giving medications and monitoring for the side effects. The one more fear is the rheumatological drugs have side effects. Yes, they do have side effects, but they are much more safer than traveling in a two-wheeler in Mumbai or Bangalore or Delhi. So much more safer. But we take the risk of this risk every day. We travel to work, we go by auto rickshaws, travel by many means. So we have to give them the right perspective. Otherwise, people are scared of unknown. So once they realize, okay, 98% of the people who take a medicine don't get side effects, only 1%, 2%. If side effect comes, doctors are there to look for it and change it. So with this information, if it is percolates into you, the fear of medicines will go. And so that more people will take the right kind of medicine. Apart from medicine, you also require exercises, diet. There are some things in our hand. Like some of the diseases are due to presence of certain genes in the blood. So we cannot change the genes, but we can change the expression of the genes by doing the right things. Doing regular exercises changes the way the genes express themselves, and the right kind of a diet, what we call as an anti-inflammatory diet, which is fiber-rich food. What contains fiber, which is vegetables, fruits, and your channa, rajma kind of things. Rather than we are heavy on chawal roti. That is our main food, and we use this as a small piece. I would be happy if you reverse it. You have more vegetables, more channa, rajma, and little bit of rice in your food. That becomes an anti-inflammatory food. Very simple. Only you have to make a paradigm change in your thought process. So these are the things which will help. And Indian Rheumatology Association will act as, what should I say, educational knowledge partner with patient support groups. And we would be happy to have more patient support groups developing from the patient themselves. This kind of a meeting, you meet other people with the same disease, and it is nice to nice club of patient arthritis club. And last year I went to Hyderabad in one of the rheumatology centers. They have done a ramp walk for patients with arthritis and lupus. To my surprise, there were almost 50 to 60 women participated in it. There was a woman who won the second prize, of course. She walked with a walker, with a crutch. And she came well nicely dressed. So they gave them a confidence that the disease is only a small part of our life. And we are not arthritis patients. We are so-and-so, Mrs. XY, with a small disease. And there is more to life than being a patient alone. So this kind of activities we encourage. So we can be knowledge partners. And also we would like to handhold the patient support groups in their effort to get medicines cheaper, medicines available in government schemes. And probably we'll also, we're trying to try our best to get the insurance cover for our patients, because if you have arthritis, insurance is denied routinely, even for other conditions. So we are trying our best. This is pretty difficult to break the apathy of the government and authorities, because these diseases are chronic. Acute diseases are attractive. A heart attack, people die. If I am unlucky, if I get a heart attack, I might fall down and die here. That become a news tomorrow. A doctor from Bangalore dies in Thane while talking to a patient. It becomes a news. But if I have an arthritis, slightly I'm limping around here, nobody bothers. So, and cancers are emotional, and disease like diabetes, every politician has a diabetes. So, they tend to give concessions to this group of illnesses, and diseases like rheumatic diseases generally are little bit neglected, and they don't seem to um, give too much of importance. The patient's voice has to come, the politicians will hear and listen, and we can partner the effort. We can provide them the data, we can provide them scientific literature so that they can take action. I think with these few words, my sincere thanks to all of you for coming here, and particularly Lata Madam and the entire Mumbai Rheumatology team for inviting me to be here and to share a few moments with you. Thank you very much.